I'm Dr. Kenneth Iguda, consultant gynecologist and an IVF specialist. Often, we meet clients who would request that I want to undergo an IVF treatment, I want my eggs retrieved and fertilized, and I want them frozen, and I'll come back for them and get my embryo transfer. This request is becoming numerous, but it's not coming out of nothing. This is because there is improvement in IVF treatment modalities, and we seem to be achieving a lot of successes following frozen embryo transfers. And of course, it only makes sense to request for the embryos to be frozen and to be transferred on a fresh treatment cycle. The reasons for these are usually that for an IVF cycle where you have the conventional stimulation, occasionally high number of eggs are retrieved. And when you have numerous number of eggs being retrieved, you have a load of progesterone in the human system. Implantation may be negatively affected by a high level of progesterone. And so when these eggs or embryos are frozen, the body takes time to normalize, and the level of progesterone normalizes. And when transfer is done on a fresh treatment cycle with controlled hormone administration, you achieve a fairly normal level of progesterone that is acceptable for implantation, and implantation rate and pregnancy rates increase as a result. This is the simple reason why a lot of clients will request for embryos to be frozen and have their transfer on a fresh cycle. But there are other conditions also that embryos could be frozen and transferred on a fresher cycle when there is a disharmony between the couples involved in an IVF treatment cycle. The embryos can be frozen until the disharmony is resolved. When there is ovarian hyperstimulation syndrome, that is a threat or a risk to life, the eggs or the embryos could be frozen, and the candidate or client is given time to recover, to normalize, before embryos are thawed and replaced into the uterine cavity on the fresh treatment cycles. Occasionally, the eggs or embryos could even be frozen for social reasons, while the client or patient takes them up at any time that is deemed fit. So these are some of the reasons why people request for either eggs to be frozen or embryos to be frozen. You could get more of this information from our website, or better still, when you have a direct talk with your gynecologist. Until I come your way next time, I'm Dr. Kenneth Iguda, consultant gynecologist and an IVF specialist. Thank you.